Welcome back to Startup Health Now. My name is Unity Stokes, co-founder at Startup Health. This is the podcast where we get to have deep and meaningful conversations so we can get to know the change makers, the entrepreneurs and innovators who are transforming health. Stick around, it's going to be another great show. I want to welcome two amazing people. The first is my business partner of 30 years, Stephen Krein, co-founder at Startup Health, one of our longest health transformers, most successful health transformers, Sami Inkinen, the CEO of Virta Health. They are going to kick it off with the fireside chat. Steve, over to you.
Thank you so much for being here. It's great to see friends, old friends, new friends, and I'm not saying old friends, but old friends who have been with us since the very beginning. I'm incredibly excited to emphatically introduce Sami to this community. Although he doesn't need an introduction, nobody has really spoken to Sami in 2026 yet about not only what's occurred in the last couple of years, but what's occurring over the next couple around AI and healthcare. I wanted to start out, for those who don't know Sami and what he's created at Virta, you might have, when you were buying a house, selling a house, come into him before in a different industry, which was real estate. And he and his co-founder built Trulia, took it public and sold it. Before that, he actually was growing up on a farm in Finland. And so between Finland and Trulia and Virta, I can't help but think, what is the connective tissue, a farm in Finland to the health?
That's not the question he was supposed to ask me first. But Stephen was asking me earlier, it's like, do you want to see the questions I'm going to ask? And I said, actually, no, because it's going to be boring if I know the question. You probably know, many of you probably know that Finland is the happiest country in the world for 5 or 6 or 7 years in a running. Do you know why and how? That's a very good question. No, actually, the answer is the unhappy people like me left the country. Like literally. So you just have the happy left. And I mention that because the one connective tissue there actually is that I've always been wired like that in my mind, like building and changing and fixing. Like I kind of feel constantly unhappy, which is not a great state of being, but it's probably good for an entrepreneur. But more specifically, how did I go from a real estate guy to healthcare and reversing metabolic disease at scale? Obviously, technology is the hammer that I've always had in my back pocket. True, in the end, was a tech company, a real estate marketplace. So same thing with Virta Health. Technology plays a huge key part of the company. But how that leap happened from real estate marketplace to reversing metabolic disease, very, very brief version is that I'm going to make a confession. For most of my life, I thought if you are struggling with obesity or type 2 diabetes or any of the metabolic diseases, the only person you can blame is yourself, because maybe you're lazy and you're not doing the obvious things. That's how I thought most of my life. Until I found out that I was actually pre-diabetic myself, despite being a world-class triathlete. And pun intended, that was a little humble pie to eat, and realize that you can actually be metabolically unhealthy, even if you kind of try to outrun your diet. And that got me very interested in healthcare and metabolic disease, and then discovering eventually that you could actually reverse metabolic disease and diabetes and obesity. So here we are, unhappy, pre-diabetic person trying to solve metabolic disease globally.
For those who don't follow Sami on LinkedIn, you not have a perspective of the non-product and service part of Virta. It's how he's building Virta. And I'm fascinated by how, as AI was becoming commonplace language and discussions over the last couple of years, you were early at it, working and thinking about how to leverage it in how you're building Virta. So I want to touch for a second on how AI has gone into both backstage of Virta being built as well as the front stage.
Yeah. Well, I'll start from the backstage. Basically, every company these days is either it is an AI company or you say that it's an AI company. Well, you kind of have to be an AI company. If I start from the backstage, sort of the cliche thing to say these days is AI doesn't replace people, but people with AI will replace people. And I actually do believe in that. So it's just sort of some nuts and bolts things that we've done 2-3 years ago. It became clear to me that you're either AI or you're going to go out of business. So on the backstage side, I will give you an example. In each of my board meetings, I have one slide that's like here's what I, as the CEO and co-founder, are focused on. It's usually 3 or 4 bullet points. I think I started 2 years ago. One of those 4 bullet points was AI natification of the entire company. Like AI natification of the entire company, whether you're in finance or HR or engineering or sales or whatever, marketing. And that became a huge focus. And I have to give you credit to a lot of our team members. In fact, I saw Lucia, one of our chief people officer there on the back. Just to give you an example, today you can't get a job at Virta in any role unless you pass an interview that literally tests how you use AI and practically and what's your experience. That's one example. So whatever your role is, even if you're an EA to one of our leaders, we still have EAs, not AI yet, you have to pass that. So that's one example. We also formed a squad that has an engineer and technical capable people who go from function to a function. This is the back office side of things, to make the function as AI native as possible, ultimately to lower costs and scale faster. That's kind of the back office side of things. Front office, obviously we could talk about hours, but I'll just give you a couple of examples. First of all, you didn't go too much into detail, but we reverse metabolic disease such as diabetes, type 2 diabetes, and obesity with nutrition. The challenging piece using nutrition as a therapy, there's a lot. One is that pretty much nobody has been able to make it work. But the challenging piece is when food is therapy, people make 2 to 3 to 4 medical decisions per day. And what you decide today is different from tomorrow and day after. And for every person, it's different. It's a very complex problem to solve to make it work in the real world. That's actually a perfect problem for software and AI. And what we now have is, I think I can confidently say, the largest database in the world of human biomarkers, longitudinal data for metabolic disease reversal on a daily basis. So we have these massive data sets. So we are using that with the goal of essentially building multiple agents for each patient who are working 24/7 to reverse their metabolic disease. And the approach that we are taking on the front-end side is, if we take a car analogy, it's more the Tesla approach to self-driving than Waymo, meaning we have in-house doctors, in-house coaches who are on the steering wheel, and then we incrementally introduce AI features, as opposed to the Waymo approach, which is we can't do anything until we have FDA approval for a black box that's going to cure all the diseases. Hopefully that back office, front office, but yeah, that's the way it works.
What's the most controversial thing that you continue hearing about how Virta is solving this without GLP-1s, or how to safely integrate it? And I'm asking around the notion of what's the thorn in your side as a CEO that you want to keep educating the world about with your not only significant reach as an organization, but you have so many customers that stay on and engage with Virta. And I think there's a lot of people that over the last decade have tried, but Virta succeeded.
What's a thorn on my side? It's my kids. I have 2 girls, 8 and 10, and they're very annoying. So that's a real, professionally, I love my job. It's easy. It's pretty easy. No, what's a thorn on my side? Well, what drives me crazy still today is that the common sense thing to do, if you have type 2 diabetes, the common sense thing to do still today in America is, chronic progressive disease, here's some insulin, come back in 5 years, we cut your limbs off or fingers off, then you lose your eyesight, and a few years later, you likely die from heart attack. That may sound like a slight exaggeration, but that is the common sense thing to do for type 2 diabetes today. Chronic progressive, here's insulin, we increase doses, then you have microvascular damage, macrovascular damage, amputations, and death. This is common sense. Meanwhile, we've been able to show at scale hundreds of thousands of patients treated, hundreds of millions in revenue. Last year grew 75% year over year. We can systematically take a person with type 2 diabetes, reverse it, get the patient off of diabetes medications like insulin. So the thorn on my side is to make disease reversal with nutrition to be the common sense thing to do. And honestly, it's emotionally drives me absolutely batshit crazy. And then a lot of people still say, well, I don't think you can reverse type 2 diabetes. Well, it's happening every day.
Health moonshot.
Yeah.
The ultimate health moonshot. I don't know how many companies in the room can claim to have had a customer tattoo their brand on their body, but you did.
Not one, not two, not three, not four. It's more than that. I don't know what the number is, but there's quite a few. Yeah.
Why? What did you do to create a brand that has customers willing to do that? And I know Trulia wasn't tattooed on anyone's skin.
Monthly users. So I don't know.
Talk about it though. How did it make you feel? I mean, that's really remarkable. And I don't think we've spoken since I heard about the first one. So tell us about that. That's a really unique.
Yeah, it's humbling. Well, obviously that's not the goal, but it's quite humbling that, you have a for-profit company that's delivering a product or service, and your customers willingly decide to permanently tattoo the company logo on their bodies. It's very humbling to see that. And I guess to some extent, it is a proxy for the human impact that we deliver. And almost like materializes the result and the feeling that our patients have, which is to say that it's not that they go to LabCorp or Quest and get a lab result and say, oh, look at that, A1C has moved from that number to that number, but it's the kind of words that we hear from our patients. You gave my life back. I feel like I have future. Those are the kinds of words and descriptions we hear, and maybe the tattoo is kind of like a manifestation of that.
The interesting thing about this moment, 2026, we're talking a lot about AI, how AI is transforming entrepreneurship companies. I know as a founder for 30 years, having these kinds of tools when you're starting.
You're 29.
Yeah, exactly.
Right, yes. When it started out.
When you were launching Trulia, imagine having these tools today that you have, that founders starting companies now. What's your advice to founders either starting their companies from scratch today in this world where tools can enable you to actually multiply the capabilities of each team member like you described?
Yeah.
Or a company that's been around for a while and needs to take seriously the either reset pivot or repackaging or realization that it's a different world?
That's a good question. Well, there's two different worlds there, right? Obviously, if you're starting from scratch today and you want to be a venture funded company, it's nearly impossible. We have venture capitalists here in the room, so they know better than I know, but it's nearly impossible to get any funding unless you are truly AI native and artificial intelligence. Is it advanced intelligence? No, just kidding. If you don't have AI at the core and you're starting a company from scratch and trying to get funding, you probably don't even get a meeting with VCs. Is that fair? VCs, others in the room. So you just have to, that's kind of I would say, the table stakes these days for starting a company. If you're an existing company like us, well, first of all, making any changes is harder. But obviously the advantage, for example, we have clients, we have channels, we have data, we have, patients every day. So that's an asset that we have. I think for an existing business, at least the way I like to think about it is, let's not do AI for the sake of AI. And in what we get paid for, the reason we exist is patient outcomes and reversing metabolic disease, such as type 2 diabetes and obesity. Like, how do we harness AI? And let's measure the success of that in the end result, which in our case is better patient outcomes. So if you're an existing business, don't lose sight of, changing your company domain name from Virta.com to Virta.ai, may help to raise the next round for an existing company, but that's not what you should be doing. So I don't know, maybe there's a couple of wisdom.
Yeah, that's great. Well, I think there's a lot of people following you, not only because it's been talked about that you're on the track to follow like Trulia, a company that's growing quickly and I think becomes
to be acquired by Zillow. No, they are going to acquire Virta Health.
But, the trajectory you're on, there's a lot of people watching and trying to figure out. And yet, if you follow his LinkedIn, you share the playbook a lot about how you're making decisions before the board meeting with your team, not just your leadership team, your employees, all the way through an organization. Every generation has somebody that does it, but we're living in a moment where you're really like just a couple steps ahead, sharing right back. And it's not from a position of you've got it all figured out. I really admire that. Why are you spending your time doing that?
Well, first I have to say, sometimes people are like, wow, your PR team is great. They're like, they are producing so much content. And I'm like, oh, where did you see it? Oh, on your LinkedIn, my personal LinkedIn. And just to be clear, all the crap and typos and things written 100% mine. Our PR team would not, marketing team would not make mistakes. So I actually do write it myself. Why do I do that? Number one is I like it. Like as a CEO founder, yeah, there's some diaper changing you have to do as operator, that you have to do things that you don't like. It's like with kids, you have to change diapers. I didn't like it, but I had. But mostly I like try to do things that I like and are somewhat valuable. So I like it is number one thing. Number two thing is trying to justify the business benefit. I think these days, if you don't humanize your company and your organization, it's hard to succeed. It's hard to succeed in recruiting, sometimes even in fundraising, with clients. Like, I think you have to, and I try to humanize it through that channel. I'm not very good at Instagram, and that's not my game. TikTok's not my game. My LinkedIn is for a engineering-minded Finnish person. Like, LinkedIn is way better platform to write, but that I think I try to humanize. And then there's a little bit of an element of what you guys have done very well, Startup Health, and thank you for your support. Quote unquote, giving back. Like, this is my third company. Truly, I went public now 10 years on this journey. Like, I have a lot of battle scars. And if I can give back, even in a small way, for the 20-year-old or 25-year-old or 30-year-old who's coming behind, then fantastic. Yeah.
What's up for the next 12 months, 24 months that you can share here? What are you seeing in the space and Virta? Like, talk about, metabolic disease space and then Virta. Next 12 to 24 months.
Yeah.
Forward to.
Yeah. Well, I'll start from kind of like a positive, happy. Yeah, almost for a decade, it was like fighting for survival. And you go from one venture funding to another. And for most companies, and certainly it was for us as well. And sometimes I say, especially in B2B2C healthcare, that's when innovation goes to die. Sadly, that's when innovation goes to die. Why? Because it's incredibly hard to scale and get to a point where profitable and you have a real business. And like I mentioned, we are a couple of $100 million revenues and had a break-even point last year. So we climbed over the first hill, which is to say we're here to stay. This is real. And so that's fantastic. So I don't have to spend too much time. Are we going to go out of business or running out of money? So now we can focus on the real work, which is scaling. So huge focus for us this year is the scaling and doing the work that we do, which is metabolic disease. There was the second part to your question.
The space.
The space. Yeah. That's
had me wondering too.
And one thing, it's actually pretty encouraging. So we've been trying to shout from the rooftops that metabolic disease, type 2 diabetes, obesity are reversible. The root cause is nutrition, and you can't solve food with drugs. Like, that's kind of been pretty consistently our message for a decade. And finally, we have data to show that it works. And the paper coming out showing that we actually reduce strokes, heart attacks, and deaths as well, which is pretty strong data set. But what's very encouraging in this space is that I think there's a broader awareness about metabolic health, metabolic disease. McKinsey released a report last May, a year ago, global report, Metabolic Health Revolution. Even our government changed their food guidelines. So whatever you think of it, it's definitely a step towards the right direction. So I think there's a much broader awareness that, hey, we are essentially metabolic disease is bankrupting us. That is to help epidemic of our generation. Sure, medications are important. Sure, managing these diseases is helpful. But fundamentally, we have to address this at the root cause. I think there's a broad awareness of that, which is very encouraging. And at minimum, it's a tailwind, side wind for us, and hopefully.
What's the next game changer you're excited about? What either unlock, tool, announcement, technology company are you most excited about that you're watching and excited about in a way that you haven't been in a while? What's the next thing that you're
in the healthcare space or in any? I mean, it's the advanced intelligence. I don't want to beat the dead horse, but it's the when we are standing on an exponential curve and on the base, it may seem like, well, it's going to be it's going to be insane. Like this year and next year, like what's possible? Like I have no idea what's possible at the end of this year because of AI. Even for us and in healthcare, we are on this exponential. Just think about iPhone came out and now it's like, sure, like maps and real time and podcasts and audiobooks and everything. That's going to happen 10x over the next 24 months. So I'm excited to be alive in this very moment. to be running and scaling a company in this very moment and being able to leverage and just seeing what happens. And hopefully it's mostly for the positive.
Fantastic. Last question, AI first or AI second? When you wake up to work on a problem or capture an opportunity, where does AI fit into your sequence of thinking about how to solve something as a CEO?
It's usually AI first, and I generate kind of like a list of things. So I don't waste time thinking different angles. So I get like a long list of ideas and angles, many of which could be complete BS, but I can start from that and then start thinking versus spending a lot of cycles trying to come up.
Fantastic. I want everybody to join me in thanking Sami for joining us today. It's been an honor. You know, I spoke to you before you started Virta to be supporting you and for you to be active in our community and such a symbol of how to do it right. Thank you so much. Appreciate it.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.